Hi there, my name is Amy Chang and I'm currently enrolled in NR 506 Healthcare Policy in the Master's Program at Chamberlain University. Today I'll be discussing the global concern of childhood and adolescent obesity. In the past 30 years, the occurrence of overweight in children has tripled. In the United States today, 1 in 3 children and teens are either overweight or obese. Childhood obesity is regarded as the most common prevalent nutritional disorder amongst U.S. children and adolescents. Childhood obesity poses an increased risk for poor health amongst people at an early age and contributes to the manifestation of multiple chronic diseases, including cardiovascular disease, type 2 diabetes, asthma, joint problems, and several types of cancer. With increasing numbers of children becoming overweight, healthcare providers need to search for effective methods of treatment and prevention to combat further increases in childhood overweight. There are many factors that contribute to childhood obesity, including genetic, behavioral, and environmental. Although this public health issue involves multiple levels of government, my most immediate target to recommend changes will be at the local level in regards to environmental factors. Schools play an important role in a child's development and maintenance of healthy diets and physical activity habits. Educators and legislators should understand that the school provides the optimum environment to reinforce healthy eating and physical activity behavior. It is the duty of healthcare providers and policymakers to maximize the effort in curbing the epidemic of childhood obesity. The two most important initiatives to consider in evaluating the resolutions for the childhood obesity epidemic is a comprehensive school nutrition policy and physical activity promotion. With the increased use of electronic devices, TV viewing, and less time spent participating in outdoor activities, children tend to adjust to a sedentary lifestyle that contributes to the prevalence of obesity. My recommendation for the policymaker is to implement educational programs that encourage and involve parents and caregivers and community members in making physical activity enjoyable. By incorporating games that result in fun and pleasure will allow the children to see that this type of activity is not a form of punishment. This will help improve physical activity in addition to the requirement of physical education duration in the school curriculum. The food and beverage industry in the United States also plays an important role in influencing the dietary habits in children and adolescents. It would be highly preferable to exclude high-energy processed food and snacks and sugar-sweetened drinks from being readily available in the school environment. If that is not possible from a business standpoint, my recommendation is to educate children on healthier options and include fresh ingredients to school nutrition. It may seem costly to incorporate fresh fruits and vegetables, but it's important to remind policymakers that the medical costs associated with obesity are estimated at $147 billion. That is an amount that exceeds the price of healthy eating. While there is no perfect solution to combat the obesity epidemic, it is evident that lifestyle changes such as a well-balanced nutritional diet and adequate physical activity can positively impact the well-being of children and adolescents and reduce the prevalence of childhood obesity. Thank you for listening.